Welcome. In this video, we will discuss about the mission COVID Suraksha. So a lot of countries has now started with their vaccination program. So India has also streamlined its vaccine development program in terms of the vaccines for the COVID-19. So in this video, we will discuss about what the mission COVID Suraksha is all about, what are its objective, from where it is going to get the fund and any other information which is important for you to know. So let's begin. The government of India has announced the stimulus package of rupees 900 crore for the mission COVID Suraksha. So this is something which was in news. It is the Indian COVID-19 vaccine development mission which will help development process of the vaccine candidates. So various candidates in India is also muted, and all these candidates will get a streamlined kind of a flow of fund as well as the focused attention under the mission COVID Suraksha. So that is the plan, and the government has sanctioned rupees 900 crore for it. The mission COVID Suraksha is India's targeted effort to enable the government the development of indigenous, affordable and accessible vaccines. So what is the idea? The vaccine which is going to be developed in India should be like indigenous. So the vaccines candidates which are eligible for this scheme are the indigenous ones. They have to be affordable as well as accessible to the masses for the country and will complement the ongoing mission of Atmanirbhar Bharat. So the idea of Atmanirbhar Bharat, self-reliant India, is also along the line that India becomes self-reliant in terms of the vaccines also. The center has announced this package during the third economic stimulus. So the 900 crore has actually been announced in the third economic stimulus. The mission, with its end-to-end focus from pre-clinical development through clinical development and manufacturing and regulatory facilitation for development, would consolidate all available and funded resources towards accelerated product development. So it will actually take care of the entire product cycle of a vaccine, starting from the preclinical development to the regulatory facilitation as well as all the consolidation of all the present efforts which are there in the market. So this is the major goal. It is end-to-end targeted mission for developing vaccines for COVID-19 in India. Now let's go ahead and try to understand what all the phases of investment is provided under the COVID Suraksha mission. So phase 1 of the mission has been allocated rupees 900 crore for a period of 12 months. So for 1 year rupees 900 crore has been allocated as part of the third economic stimulus. So this is something you need to know, that what is the UPSC has not asked like exact amount, but knowing the approximate will obviously help you out. This grant will be provided to the Department of Biotechnology for research and development of Indian COVID-19 vaccine. So which is the department which will spearhead the whole program? It is the Department of Biotechnology. It will be led by the DBT, by Department of Biotechnology, and will be implemented by a dedicated mission implementation unit at the Biotechnology Industry Research Assistant Council. So VRAC is the one which like at their house, a dedicated mission implementation unit will be established, which will be working under the DBT and will work to streamline overall the products for the vaccine development in India. The existing activities under the National Biopharma Mission and the INT-SEPI mission will provide complementary strength to this mission. So we already have ongoing mission of the new National Biopharma Mission, which is again BIRAC is the one which take care of it, which have the tendency to increase the biotechnological innovation in India. So National Biopharma Mission is already there. Then INT-SEPI mission is also there, and both of them will also complement the COVID Suraksha mission. The DBT is supporting the implementation of the INT-SEPI mission, which is the epidemic preparedness through rapid vaccine development, support of Indian vaccine development aligned with the global initiative of the Coalition for Epidemic Preparedness Innovation, CEPI. So what is INCEPI? It is the Indian version of the CEPI, which is your Coalition for Epidemic Preparedness Innovativeness. Indian CEPI mission was actually approved in March 2019. So this is even before the COVID thing. For other epidemics also, the vaccine development under the program of INCEPI was already underway. We already have a national biopharma mission, and both of these missions are now going to strengthen the mission COVID Suraksha, which is specifically going to focus on the vaccine development for the COVID-19. So these are the details you need to know. Now let's discuss what are the objective of this mission. So accelerating preclinical and clinical development. So we need vaccine in a quick succession because of the kind of havoc the pandemic has caused. So acceleration in the preclinical and clinical development is one of the objective. Then licensure of COVID-19 vaccine candidate that are currently in clinical stage or ready to enter the clinical stage of development. So providing license to the appropriate vaccine candidate is also one of the objective. Establishing clinical trial sites so that the clinical trial could be conducted. Strengthening the existing central laboratories and suitable facilities for animal studies. Production facilities and other testing facilities to support the vaccine development. So again, vaccine development goes through various phases of trials, and in that you will require the infrastructure. So mission COVID Suraksha will also work on equipping the laboratories with all these facilities. Supporting the development of common harmonized protocols, training and data management systems, regulatory submission, internal and external quality management system, and accreditation. So in order to reduce the confusion or reduce the wasted effort, standardized protocol would be issued. That is also one of the objective under the mission COVID Suraksha. Supporting capabilities for process development, cell line development and manufacturing of GMP batches for animal toxicology studies and clinical trials. So again, developing capabilities so that the clinical trial or the trials on animal could be conducted seamlessly without harming any person involved in the whole process. Developing suitable target product profiles so that the vaccine being introduced through the mission have preferred characteristic applicable to India. So that is also one thing, like what are the domestic conditions through which the vaccine has to be having the characteristics so that it is suitable for the masses of India. So that kind of a standard or target product profile would also be provided. It is one of the objective of the COVID mission, COVID Suraksha mission. So these are the various objectives on which these are the broad high level objectives under which the mission COVID Suraksha is going to work. Now let's also try to see which are the what all vaccine candidates have been there in India so far. So a total of 10 vaccine candidates have been supported by DBT. So Department of Biotechnology has supported 10 vaccine candidates so far. At both academia and industry, and as on date 5 vaccine candidates are in human trials. So 5 of them has also gone into the human trial and 10 has been kind of supported by the DBT. So this is COVID Shield. The Serum Institute of India is conducting the phase 3 trial of the Oxford AstraZeneca COVID-19 vaccine, so COVID Shield. Then we have Covaxin, which is the indigenously developed Bharat Biotech and Indian Council of Medical Research vaccine, has already started the phase 3 of clinical trial. Then we have ZY COVID-D, which is indigenously developed vaccine by Zedus Candila, has completed phase 2 of clinical trial in the country. Then we have Sputnik 5. The combined phase 2 and 3 of clinical trials of the Russian COVID-19 vaccine Sputnik 5 in India are about to get started. This is not yet started. Then we have BNT162B2, which is India is focusing on training for conducting the phase 2 and phase 3 of human clinical trial of the Pfizer COVID-19 vaccine candidate along with the lines of India's regulatory mechanism. So these 5 vaccines are already get into the human trial phase, and these are COVID Shield, Covaxin, ZY COVID-D, Sputnik 5 and BT 162B2. So just try to remember the name of these few vaccines, and keep an update on which vaccine actually get approved by the Indian government and which are like being used for vaccinating the masses in India. So this is something you need to be updated for. So I hope you have understood this video. If you have any doubt, feel free to drop a comment. Thank you.